When my doctor used the word obesity for the very first time, I'm thinking, not me. I'm fat, I'm depressed, but I'm not obese.
According to the CDC, more than 50% of adults and more than 15% of children here in the U.S. are obese.
If a patient wants to be in good health, they have to maintain a certain weight. And sometimes it's very difficult, so we deal with morbid obesity. We don't only deal with obesity, mild obesity. But it's very difficult for a patient to lose weight once they have certain weight. It's a set point.
Complications of both obesity and morbid obesity can be numerous, systemic, and even life-threatening.
High blood pressure, diabetes, sleep apnea, hypercholesterolemia, and everything related to central obesity, and sudden death. You can have a stroke, you can have coronary artery disease, and so forth.
Obesity specialists like Dr. Ramos Kelly say that although treatment is critically necessary, there are obstacles.
The most powerful therapy nowadays is weight loss surgery. This is not inexpensive for them. It's only that in the United States, surgery, bariatric surgery, is very expensive.
And a lot of times when I'm explaining the surgery to different patients and potential patients, I explain how it has come in and how it has changed my life. But it isn't about whether or not what size gene you are or how much weight that you have lost. It's looking at what's in the inside of you with all the fat that can be around your organs, which creates high blood pressure, strokes, heart attacks, and people can literally die.
There was something about Dr. Kelly that when I got to talk with him on the phone, I felt that positive energy and the love coming through on the phone. And I liked the idea of, didn't mind coming down here to Tijuana. Of course, the price was a lot less here.
Both Cindy and Natalie chose to have Dr. Kelly perform bariatric procedures in Mexico at a state-of-the-art hospital in Tijuana, right near the U.S. border.
We offer this state-of-the-art facility for our patients to come here, have the same level of care in the States with an affordable price. Tijuana is a very progressive city. It has a lot of misconceptions, but we are in the business of helping people achieve their goals.
Dr. Kelly is a member of both the American Society for Metabolic and Bariatric Surgery and the International Federation for the Surgery of Obesity.
It's called the gastric sleeve. It's a vertical gastrectomy, and it's very effective. There's no rerouting of the GI tract, there's no anastomosis done, and you have your stomach, only that it's smaller. I take out 80% of the stomach.
I found their website and I sent an email, and his assistant Gabby, she called me and we were able to talk, and actually she connected me directly with the doctor and he answered a lot of my questions. And you don't really get that kind of service in the US. You don't hardly ever get to talk directly to your surgeon. So once I talked to him, I felt really comfortable, and they set me up, flew me in, treated me like gold. I really thought everything was actually better. I enjoyed the hospitals. I thought they were cleaner. The hotel that I stayed in was everything. It was wonderful.
Dr. Kelly says the treatment for obesity patients is multifaceted, encompassing more than just surgical procedures.
I want to see this as a process, not as a surgery, and they need to follow up with me and my team. And because when I operate a patient, next day they're still obese, so they have to understand, and a patient has to have enough mental capacity to understand what they're getting into, and they have to comply with all my guidelines.
Barb was a big help in answering my questions and telling about what she went through and how excited she was and what went on, and she said, telling me that I'll be right there with you, and the coordinator said, well, I'll be right there in the in the surgery, and that's a big help.
His patients say the long-term results speak for themselves.
It's remarkable from the size that I had began at to the size that I am right now. It's where people don't even recognize you wear a good fit in half of the pants that I used to wear before.
I went from a size 18 down to a size 8 as of yesterday, and it's only been 4 months for me. I am so excited what this is doing for me, not only for my health, but for my self-esteem. And I really thought about this, and I'm a better wife, I'm a better mother, I'm a better business partner, I'm a better person.
I had the surgery in '07, September, and was started out at 260 pounds. So obviously my surgery was very successful with the sleeve. You know, if you eat healthy, you really maintain a normal, healthy life, and you don't really ever have to worry about dieting again.
I've referred some of my friends, which should say a lot, because I trust him, and he's became my friend. And that's pretty incredible for a surgeon. And I know when he saw me, when I got off the plane, and he saw me, he was so excited because of the change in me. And he said, this is why I do what I do.
The patient's life is totally changed, and at every level, mentally, job opportunities, health, overall health.
America's battle with obesity continues to create difficult challenges for medical experts and patients alike. Now the options include international facilities and specialists that provide safe, expert care and successful long-term results. Obesity is an epidemic affecting more than 1/3 of American adults. The health issues are devastating. The results are debilitating, even deadly. Obesity increases the risk of coronary heart disease, type 2 diabetes, certain cancers, sleep apnea, osteoarthritis, and respiratory problems. For many, bariatric surgery is just too expensive. The Weight Loss Surgery Clinic and Dr. Jaime Ricardo Ramos Kelly are making a difference, offering cost-effective, safe weight loss procedures at world-class, state-of-the-art medical facilities.
I want to live longer. I want to be able to be with my grandchildren. I want to have the compassion to help other people who are on the same road.
Your new life is waiting for you.